Okay, so I'm Hilary Frank, and I'm the Cornwall councillor that represents Saltash South, which is the patch just where St Barnabas Hospital is. I've been on Cornwall Council for 6 years, and within that there are various committees within Cornwall Council, and one of the committees that I sit on is the committee that looks after children and families within an area. So that has a huge remit covering education, but also public health nursing as well. So I came along today for loads of reasons actually, because St Barnabas is just rooted in our community. It's a very special building. A lot of people have got some very special memories of people who were cared for in St Barnabas. The minor injuries unit closed down 2-3 years ago, and it's not open for inpatient beds anymore. And we want to see what the future holds for St Barnabas. The inpatient beds, the MIU, played a really important role in the past. Is that the kind of role it needs to play in the future? Should it be something different? What does our community need? What can we do to make St Barnabas the thriving hub that it used to be when the nuns were there? Just to see what can make St Barnabas a thriving hub that it used to be, and what our community actually needs it to be going forward. So I was really encouraged today. There are loads of people from different disciplines, from different backgrounds, and some very good thought-provoking statements. We had the head of a local primary school who's really calling for much more integrated services looking after children in the area. So it's not just the elderly people, it's also children, people who are isolated. What can we do to provide some kind of hub for all of those people that will really bring the community together?